We'll go ahead and let them in as well. Well, good morning. We're very excited to have Dr. Larry Empting. I have met him probably, what is this, about a year and a half ago? Yeah. He actually attended our gala last year, and I'm very interested in what he is doing a lot of research on and his work. I'm going to go ahead and actually let him explain a little bit more about himself to you, but just know that he is local and he has had his own practice for 27 years. So Dr. Empting, it's all you.
All right, Don. Well, thank you. And thank you so much for letting me to come on the Aloha International Television Network here and talk a little bit about what we're doing. You might be able to tell a little bit. I have a slight accent, I think. You can probably tell that I'm from Minnesota originally. And I'm going to tell you a little bit because we're going to be talking about the neurologic and the psychiatric aspects of mold exposure, which during the COVID virus is interesting because it's something to think about, something you can do around the home that theoretically could be contributing to memory and other neurologic disorders that can occur. So I'm going to tell you a little bit about my background because that'll lead us up to where we're going to be looking and talking about today. Being originally from Minnesota, I had a big interest in kind of mind and brain interface components. So the brain and the thinking, and so I majored in my undergraduate years in zoology and psychology. And then I started work for the University of North Dakota, which is right across the border from where I grew up. And I was the research assistant for the chairman of psychiatry, Russell Gardner. And Russell's an interesting fellow. He's a psychiatrist and psychoanalyst who was originally from Wisconsin, but he went through the NIH and did some very interesting research. He was interested in researching in Alzheimer's disease. So this is back in the mid-70s. So I was hired on and we were doing psychological tests, we were doing scans, we were doing, when patients died, we would do testing on brains and look at the different pathologies. So I had an early interest in Alzheimer's. In fact, it's one of the things between mind and brain that got me interested in actually going to medical school, which I did at the University of Minnesota, Minneapolis. Then what I did was go out to Johns Hopkins and I did double training. I trained first of all in psychiatry and then in neurology. What was interesting is that when I started out my psychiatry residency, my very first rotation was on the ward that had the dementia ward. And one of my attendings there, you might be aware of, it was Peter Ravens. I'm going to hold up his book, The 24-Hour Day, or 36-Hour Day. There were about 3 or 4 psychiatry attending docs who had a big interest in dementia. And Peter was one of them. So I spent my first 6 months looking at both organic and psychological issues of Alzheimer's. So that was sort of the beginning for me. And then I did my psychiatry residency. And then I did neurology, where of course you look at not only Alzheimer's, but Parkinson's, movement disorders, all these other neurologic disorders that can sometimes occur in brain and the rest of the nervous system, spinal cord, peripheral nerves, and so forth. And so then I ended up being on the Johns Hopkins neurology faculty for 3 years, and I ran their pain center. And having trained in psychiatry and neurology, I would end up seeing patients that have components of both, say neurologic or neurodegenerative disorders that would have psychiatric features. And of course, Alzheimer's, Parkinson's, all those brain disorders can have those kind of components. So I started out with that kind of background, again, integrating mind-related things and brain-related things. After that, I moved to the south east here, initially in Nashville, and then I came down with the company I was working with here to Atlanta in 1994. And not too long after I got here, I met a ear, nose, and throat doctor, Dr. Don Dennis, who actually sent me patients that had difficulty with neurologic and neuropsychiatric features with mold exposure. What's interesting about mold is that mold puts out toxins, mycotoxins, that can actually get in the system through the respiratory system, and it can circulate around. It can affect the brain. It can affect other parts of the body. What Dr. Dennis introduced me to was, first of all, how this works in patients. If you have water intrusion into your house, you can get mold growth within the walls or other parts of the house, and that can secondarily circulate these mold spores around. Those can actually get in the nose, in the sinuses, and they can grow in there. And those mold complexes can form antibodies, and they can circulate around, and they can affect any aspect of the body. My interest, of course, was how they affected brain and nervous tissue. So I would see patients, and Dr. Dennis started sending me patients asking me to manage them while he cleaned out the nose. And also, you got to clean out the environment, which would be the home environment for most people, in order to get them better. Now, what was interesting about this is that Dr. Dennis would send me patients who had what they called fungal sinusitis. The mold was growing in their sinuses. And some of them would be having what you would call in the lay world, brain fog. Brain fog is really delirium. You're like mildly drunk, and if you're exposed, you have these confusing symptoms. And then when you go, for instance, outdoors, it clears up. You go down to the coast, it clears up. What I also noted was patients that had movement disorder problems. Some of them would have tremors. They would walk like they had Parkinson's. They could have abnormal, odd movements, tremors. And many of these patients, when I think back to my Johns Hopkins days, you see people who would come in with a lot of these symptoms, and they would have normal MRIs, for instance. They would have normal spinal taps, but they would have these neurologic symptoms. And I can go back now and think those patients had mold exposure. And what you can see is really sort of several things. You can see patients who have just mold exposure, and they can have brain-related aspects, brain fog or dementia or delirium or Parkinson's-like symptoms. Or you could have patients who have pure neurologic disorders who do not have any exposure to mold. And of course, you can have anyone with neurologic disorders like MS or Parkinson's or Alzheimer's, and you can have mold exposure on top of that. So you kind of have these three categories. So anyway, I would take care of the patients with their symptomatic aspects like memory aspects, mood aspects, movement disorder aspects. Dr. Dennis would clear out the nasal passages and the environment. And sure enough, a lot of them got much, much better. Some of them resolved almost completely. And to see the reversal of neurologic symptoms is very unusual. So it was very interesting to see that. So I started working then with some of the people nationally that put this together. They're environmental doctors that do things that have a lot to do with chemical exposures, mold exposures, different water or food toxins or food sensitivities. And so I evolved to the point where I was giving talks to these groups, and they asked me to put together a little bit of a article, which I did. And Dawn has a copy of this if you have an interest in actually reading it. But it's about toxin exposure and mold exposure and how it fits into neurologic and neuropsychiatric disorders. So I started working with those groups. I met a group out of Denver called CitraSafe, and they were putting together a series of products to help with mold-related exposures. And then part of their company is called Immunolytics, And immunolytics actually tests for mold within the home. Because if you have a patient who you think has mold exposure, you want to go in there and actually test it. And you don't want to do the testing per se like they do with real estate, where you put little mold spore traps. You want to put out actual culture plates that grow mold to see what's actually growing around there. And so that company is called Immunolytics. And if any of you have an interest in there, I'm going to kind of flash up. This is a little sheet on Immunolytics, and Don has that as well. Immunolytics actually can send you plates if you think you have, if you've had water intrusion in the house. If that water stays there more than 48 hours, you commonly have mold growing. And there's a lot of different kinds of mold. You always hear about the most severe ones like Stachybotrys, Penicillium, Aspergillus. These are the kind of molds that can be more toxic to people. And some people are more sensitive to the molds than others. And of course, you can be sensitive to the mold toxins because those can circulate all around. And you can be sensitive to actually the mold growing within the house. It will circulate, get in the sinuses, maybe even grow there. So we've seen families that have these exposures, and a lot of them will have pain-related problems. They'll have memory problems. They'll have thinking problems. And we followed some of these patients along where they got sicker and sicker and went from having a delirium of brain fog to an actual dementia that looks very similar to Alzheimer's or is called Alzheimer's. And then those patients can do very poorly. So what we're talking about is how do you look at these kind of things? Because we can all be sensitive to these. I actually, when I first moved to Atlanta, lived in a house that had mold growing in it. I just thought that's just part of, the South. Mold grows in everything. You have different, walls covered with the ceiling covered with it. But I got decreased energy. My thinking wasn't as sharp. I started getting little cardiac rhythms. And of course, these mold toxins can affect any system in the body, bowels, lungs, sinuses. These are very common, but can also affect the nervous system, give you headaches, confusion, memory problems. So I had a little exposure to that before I actually learned about it. But I still, to this day, have a little bit of a sensitivity to mold exposure. So I can go into a building and I'll have a little bit more reaction than most people will. So what's interesting and what sort of got me to spend some time with Donna and Aloha and go to the gala included the fact that many patients that may have neurologic issues may have a component where inflammation from mold exposure could be causing their disorder to be worse, or could be causing the disorder in its own primary format. So I've been working with the Immunolytics people, and there's a company called Citrasafe, and their website is www.citrasafe, capital C, small I-T-I, safe, S-A-F-E, capital S-A-F-E, and Don can give you that as well. Citrasafe makes a series of products that actually can help the brain recover and repair and run better. Glutathione, resveratrol, nitric oxide, those things actually do help the brain repair and work. It works not only for mold exposure, but for instance, I see NFL players that have had 60 to 80 concussions during their career, and sure enough, they get better with these products as well. And similar to anyone else, we have these football players check their homes for mold, because if that's adding to their memory problems, that's something in addition that you like to be able to take away. So I think with Don's introduction here and a little bit of my background and a little bit of what we're doing with cases, I see a certain number of cases that have mold exposure or think they have mold exposure. And we work through the Immunolytics people to culture their homes. There is a person there, Jeff Bookout, who's associated with Immunolytics, and it's Bookout, Bookout. And Jeff actually has experience in inspecting homes, even remotely, just to help people work out the different water intrusion issues that they might have. Putting that all together, I've become quite aware as a neurologist and neuropsychiatrist of patients that have this exposure that can have primary problems or make something that they have worse. For instance, if you have Parkinson's, you can make it worse by being exposed to toxic substances, and mold toxins are one of those components. So that's a long introduction, but it does give you kind of a little bit of background about what we're talking about. It also is something one can do when you're home with COVID. You could kind of inspect your home, go through the immunolytics people, culture your home. You can find out if indeed that's something that's contributing to headaches, memory problems, brain fog, or delirium. So you can actually sort out some of those issues and help your doc with that as well. Now, in general, most physicians get no education whatsoever in mold exposures, toxins, mold, stuff like this. So it's not something that's mainstream medicine really gets into very much. And no one does too much research. NIH does a little bit. A lot of the environmental people do their own personal research, but it's not really taught in medical school or even residency for that matter. So something that you'd have to find individual docs who have an interest in this to work up and maybe go to some of the national conferences and so forth. So anyway, that's kind of an introduction. And Dawn, I'm going to turn it back to you, and you kind of head us in the right direction you think that your viewers might want to go over. Hello, Dawn. First
Right
to Dawn.
No, just having the mute problem. Okay. So I know several of you tuned in for different reasons.
We're going to start out inspecting Dawn's home and see if her memory problems are coming from home.
Oh, so here we go. I know several of you turned in for different reasons. So I would now actually, if you would like to ask a question, that would be fantastic. If you want to go ahead and just kind of raise your hand. I think, part of what Dr. Empting mentioned, so many of us grew up with thinking we had allergies, or maybe, moving to the South, and now we feel like maybe it's allergy season, things are blooming outside of our homes, and we're just feeling, that again, it might just be a sinus. Those are things that we can move a little bit further with this kind of testing. So I will ask that, Larry, if you can talk a little bit more about the testing and what that, even though there's the Petri dishes, what that really, how that makes a difference between, you mentioned it briefly, regarding that kind of a Petri dish versus actually going and having the testing that we would normally do, again, like as you mentioned, if we're going to sell a house. I think these Petri dishes give a bigger, broader look at the different molds, and you might not even have had water damage that you know about. So if maybe Dr. Empting, if you could actually talk a little bit more about that, and then we can ask some more questions. Well, it looks like I have lost him. Does everybody see that? Okay, so guess it's just not me. Well, I think he was playing with his iPad, and there we have it. So hopefully his assistant will be able to get him back on. Well, while we're waiting on him, do all of you want to ask me a little question that I can then bring up? Because I think the Petri dishes are very interesting. I think it comes in 4, as he kind of showed you that picture of that. Again, you can get it online. It's pretty inexpensive to get done. And then they give you the results. And obviously he's somebody that you could talk to in addition to immunolytics for what the results are. Ladies, gentlemen. Yeah, okay, Sharon. You want to go ahead and unmute? Oh, okay. You need to unmute yourself.
Hello.
Hey.
Yeah, actually my question's sort of more related to the nose. So it sounded like what you do is first do your house and see what kind of molds you have. And then what if you think perhaps a member of your family already has this in their nose? I mean, would he then treat them like, do they want to do the house first and then the person, or could be simultaneous?
So I'm thinking it's obviously you need to get the house done, but probably a mixture
There
of
he is.
the two.
Hey,
So,
Don.
Dr. Empting.
There you are.
No, I'm sorry. I'm a well-trained doctor, just low tech, and it appears that our little Zoom monitor overheated. I mean, this is high tech. Give me a break. We've gone to the moon and back, but we have a Zoom deal overheating here, so it just turned itself off. You know, I tell you. So anyway, hopefully this will keep going. If I drop off, just know that I've overheated or been abducted by aliens or something like that. But so I missed the whole maybe last 5 minutes here. So if you catch me up, that'd be great.
So one of the questions, actually, I was discussing about the mold actual testing, and it's like the Petri dishes and the difference between that, really what that results come from there versus the results that would come from just the real estate test. Because I think many people grew up having allergies, or maybe they moved down south and now there's new allergies. And so we're used to maybe having some sinus issues, but not realizing the extent of what those are and how that's impacting us neurologically. So that's kind of one thing. And then Sharon just actually asked, you know, if we think that somebody we know has something like this, this issue, how would that be treated? Is it the house? Is it the person? Which goes first? So those are, I guess, the two things if you could start with.
Sure. Well, let's start out with allergies versus sensitivities, and allergies versus like real more severe disease. Allergies are where there's something in the environment, and for instance, it affects and gives you what we call an allergic reaction. That is a certain kind of immunoglobulin E. Now, if you have a mold exposure that's toxic to you, it can actually get in the sinus and it forms antibodies to that mold, because the body normally does that. But those antibodies are a different category called immunoglobulin G. And those actually are more the antibodies that fight disease as opposed to allergies. So being exposed to mold is in essence kind of getting exposed to a toxin. So it's not an allergy at all. It is actually a sensitivity and a toxicity that's getting exposed to your body. And your body, if it reacts and say it gets into the sinuses and it forms antibodies there, those antibodies can get into the blood system and circulate all around the body, can affect different organ systems. In my interest area, of course, it's the brain and nervous system. And that way you can get psychiatric symptoms, you can get neurologic symptoms, and it had nothing to do with allergies per se. So it's a sensitivity and a vulnerability, and we all inherit different abilities and sensitivities to different things in the environment. So some people are going to be more vulnerable. There's about 25% of us that have genetics that are more vulnerable to different environmental exposures, mold included. It's really a disease process, not an allergy. And if you go to an allergist, some of them will look at just the IgE, which is the allergy aspect, and they will not look at all about the immunoglobulin G, which is actually more the disease aspect. So it somewhat depends on who you see for what. But if you have someone, a doc who has an interest in these type of things, usually they're folks that could be from different specialties. Mine is neurologic or psychiatric, that have been involved in some of the national meetings or gone to national meetings that go a step beyond the allergy impression. And I think that would be important, is to see who who you're seeing, because most docs are not going to have a background or training or interest in this. So you got to find some of those odd, curious, nerdy people like myself that like different things. So that's the first step. And the second question was, where do we start and how do we sort of work this up? So for instance, if a patient comes in and they have a concern that they might have a mold exposure, or you're taking a history of someone who has, say, memory problems, and you think, well, one of the things that could kick this off might be mold. So I might ask, well, did you get water intrusion in the house? Did you see visible mold in the house? Does the air conditioner occupy the space down in the crawl space? But there's plenty of mold growing, and it gets its fresh air from there and shoots it all around the house. So if you have a suspicion as a person, not a patient yet, that your house might have some mold contamination, the best thing to do is to culture it. And the difference between like a realty assessment for mold, if you have a house that's foreclosed on, the mold inspector is going to go in and they're going to look all over the place. And a good trained inspector is going to see mold like in the crawl space. They're going to see it in the ceiling. They're going to see it in a house maybe had its air conditioning off and it's overheated, basically helping the mold to grow. So they're going to see it. So that's one step, is to actually inspect the house. Second step is they do spore traps. So they set up a machine that sucks in air, and for a certain amount of volume of air, they suck that air in and the mold spores get caught. That gets sent in and it gets counted. And that can give you a little idea of some of the circulating mold spores that might be around. The trouble is that it doesn't correlate as well to actual patient care. If you're interested in symptoms and disorders, the culture plates actually give you more information. They actually send the culture plates out. You put them out for an hour in different places in the house, and then you send them back, and someone who's actually trained in saying, this is Stachybotrys, this is Aspergillum, this is Penicillium, they will actually be able to identify which type of growth you have and actually quantitate it. They can count the number of colonies. That, in my experience, has tended to correlate better with how to assess and treat patients as opposed to just the regular spore traps. So one step is, if you have suspicions, is to get the mold plates, which are relatively inexpensive, get 5 or 10 of them, put them around, and they'll send you some instructions as far as how to put them out, where to send them, and so forth, and get them read and see. If there's no mold there by gravity plates, that's a real good sign. If you do have mold growing on these plates, then you would have to get someone in there to inspect the home to try to track down where the mold is growing, why is it growing there, or is there a water intrusion from the roof, from the foundation, from somewhere down in the basement in the crawl space. And then, in essence, you have to treat the house and you have to treat the patient. And to treat the patient, you have to clean out the sinuses, and there are different rinses and antibiotics and things you can do with that. You treat the house by remediating that, going in there and carrying out the areas that are infested with mold, and then, of course, making sure that there's no more water intrusion. And of course, you'll hear about this all the time, that some of our schools have mold in them. Some of our workplaces have mold in them. I've had work comp cases, workers' compensation cases, where a mold or water intrusion came into an office and multiple people got sick. And they're all thinking, wow, this must be mold related, because Bob's office has a bunch of mold growing on the ceiling coming in. There was a wet wall, wet carpet. So people have some clues. And of course, a lot of times you can smell it. People that have not been in your building for a while can smell it better than people that have been in the building, because in a water damaged building setting, people's sense of smell sort of gets turned off after a certain amount of exposure. So you might not notice the smell as much as someone coming into the house and saying, well, listen, that smells musty. If you have someone like myself or someone else that's been exposed to mold and knows the symptoms they get, for instance, from my mold exposure, I can tell you if I go into a home and there's mold there, I can tell because I start getting a raspy voice. I have an old weakness in one side of my face, a Bell's palsy. I start getting tingling along that area. Other people might have respiratory symptoms, asthma-like symptoms. A lot of people can tell you, having lived in a mold environment, that they can smell different components, and they can pick up on it that way. But the real bottom line is that you got to treat the patient and you got to treat the house. If you don't treat both, you can treat the patient, but if you send them back to a contaminated environment, you're just going to get sick again.
Excellent. Sharon, did that basically answer your question? Okay, fantastic. Anybody else have a question that they would like to ask? You know, I think the key thing is to know that Dr. Empting has obviously a significant amount of experience with cognitive issues, being both dual neurologist and psychiatrist. So I think all of this really plays a key role in the bigger picture of somebody's illness. Kathy, you wanted to ask a question. Go ahead and unmute yourself if you would.
Question or comment. Thank you for your time, doctor. My mom's had Alzheimer's for 12 plus years, is locked down in Ohio, so I may be at higher risk for that. And I am on the board of directors here at my condo complex, so I am familiar with water intrusion, mold, things of that sort. And I also have hay fever and allergic to trees. Cats, plants, flower, you know, all the outdoor stuff, which is drawn nose. I'm a big outdoor person, national parks, etc. So I guess any advice or thoughts with the information I just shared with you. So far, my condo, which is on the second floor, does not, to my knowledge, have any mold, nor does my mom's room. I haven't been there, been able to see her since March. We have outside visits in Ohio. So any thoughts?
Well, I culture my place probably about every 6 to 8 months, having been exposed to it before. And you can actually get mold growth from water intrusion that you don't know. It can come in, let's say you have a leak in the roof you don't know about. It's a slow leak or from like the attic area, and it can get into your building, and it can go down, and it can be behind the walls. So people can be getting symptoms without any visible mold growth anywhere. And you know, people show these awful photographs of like black growth on the ceiling or down the wall. But if you have symptoms, you know, memory, thinking, headaches, stuff like that, and you're not sure where they're coming from, you didn't have them before, one can always do these culture plates and see what you might find. Now, your mom's case is going to be difficult to go in and do culture plates with all the COVID and everything like that, but there are obviously schools, nursing homes, any communal living place can have water intrusion, and they can have mold growing in there, but you're not going to know unless you inspect it and if you try your culture plates. I would mention one thing also. I always ask patients if they have pets, because cats and dogs naturally grow some mold in their fur. And if you're going to culture your home, you should also culture your pet. You basically take the culture plate and you can kind of puff up under their belly, and you can send that off to immunolytics along with, you know, kitchen, bathroom, living room, places where water is at, and also bedroom. You want to make sure you culture that area as well. But pets very commonly carry this without any symptoms at all. Many people are sensitive to the mold on the fur rather than, say, dander, or say I have a cat allergy. Maybe it's actually mold. We used to have a couple cats, and one was very severely contaminated and had to be an outdoor cat for a while. And they're sweet as they can be and great comfort. But the problem is if you're sensitive to mold and the animal's carrying it, a lot of people have their pets sleeping on their bed with them. And of course, you're getting re-exposed. And if you get more re-exposure, you get more symptoms.
Great, thank you, because I just got a rescue dog, a dachshund.
Yeah.
And for mostly mutts, and I grew up with dogs. So I'm okay with her because that was a consideration. And I love both cats and dogs, but I chose a senior dog like me. So far, so good.
Well, that's good. That's good. They're real fun to have around, aren't they?
Yeah.
Yeah, that's great.
Thank you, Kathy.
Mhm.
Anybody else? Joe, do you have a question, or Jan or Joyce?
I'm Jan, and I don't know if I'm showing, but
You aren't.
I'll learn that later. My question is, why is there such a big disparity between what the realtors test and the Petri dish test? Is it about speed?
No, I think it's mainly the difference between looking for something simple in the environment versus actually treating patients who are ill. If you're treating patients that are ill, many of those patients have a vulnerability, immunological vulnerability to mold compared to someone else. For instance, I will have couples come in, and for instance, the husband might come in and say, well, listen, yeah, I know there's mold in our house, and look, I can stuff mold up my nose. It doesn't bother me a bit. And his genetic background might be such that it really doesn't bother him. It doesn't irritate him. It doesn't make him sick. Whereas he'll tell you, listen, my wife is crazy. She is getting confused. She's getting emotional, when in fact, she has different genetics. And with the addition of estrogen, women do have, in general, more of a sensitivity, more of a severe sensitivity to mold and mold toxins than most men do. But the bottom line is that you can get families in. Some of them might be very sensitive and symptomatic. Some of them might not be symptomatic. Now, if you're actually treating patients, you want to get the best information you can as far as what species of mold is growing, how many, what is the count of molds in the environment. For instance, if you have someone coming in and they have a culture plate and they get penicillium and aspergillus, and there's 50 colonies in that time frame that it grows in that culture plate, you know darn well the place is contaminated. You can understand why people might be sick. Now, if you get someone who's been exposed to mold, because once you get the immune system turned on, it's like a vaccine. That is, you turn the switch on, and if it's a vaccine, it helps protect against something, just like they're trying to devise a COVID vaccine. If you get mold exposure and that gets turned on, then you can become more sensitive than you were before that mold exposure. And it doesn't get turned off. You have to avoid further mold exposure, and you have to keep vigilant at keeping your own symptoms improved and keeping sinuses clear and stuff like that. So if you actually put out a culture plate, and let's say it has 4 colonies compared to 50 on another plate, if you have 4 colonies and you have someone who's sensitive to that mold, that their immune system is really geared up towards it, then you know that even 4 colonies is too much for that patient. You got to get it down to 2, or get the environment even more cleaned out. Because it's not like a normal toxin like radiation. If you get exposed to radiation and you take the irradiating source away, you're going to be okay. But if you are continually exposed and your system is sensitized to that, like it can get with mold, then you can get recreation of those symptoms and they'll flare up. So you always have to avoid further exposure for the water intrusion and treat everything that you can. Some people are super, super, super sensitive. Most of us are sort of in between somewhere.
Excellent answer. Dr. Empting, so for example, if we chose to go ahead and contacted Immunolytics and received the Petri dishes that we put out, as you mentioned, we probably need several in different areas of our home. What is the next step? They basically take it, analyze it, and as you mentioned, there could be several species of the molds. Then we take that back to somebody like yourself. Does Immunolytics help us with that? Where do we go from there?
Yeah, it's a combination. There are different docs, like for instance, Immunolytics. If you click off and put down my name as someone who's sending you to get this testing done, then they'll send me a copy of the report if you allow that. So if I had a patient that came in and they have a mysterious memory problem, and we test their house with Immunolytics, and sure enough, we show mold there, then they send me the results. And Immunolytics also will, you can call and you can talk with someone about your specific testing, and they'll tell you a little bit more about what they found. They can also have you talk to folks that are excellent. Some of them are pharmacists, some like Jeff Bookout are people who have experience with inspecting the homes or getting someone to inspect the home. And it's a little bit like a fact-finding mission. You start out by one step, and the immunolytic people are very, very experienced with this, better than anyone that I know of, at sort of sorting out what's in the house, usually what it means. They can tell you if one species are there or three species are there. They can sometimes even tell you, well, this probably started out with one species, and then if they see another species that sort of outcompetes those other molds, then that species might take over and you might have a high number of one, but hardly anything else. That means the one type of mold is sort of winning the battle, because they have these toxins to compete against each other and compete against environmental influences. So the more toxic, more severe molds are going to be the ones that win out in the end. For instance, you might have aspergillus and penicillium in a house early on, and then later on you see Stachybotrys. And Stachybotrys is one of the most toxic molds around, but it can kill other molds. So it sort of wins the mold war, so to speak, against the other molds. And they could tell at Immunolytics if where perhaps how chronic this condition is, depending on the mold species. But they're very knowledgeable about it and discuss it with you. And then if you do indeed have some mold in the house and you're having symptoms, then within your community, you need to find someone who has an interest in these kind of things. There are some medicine doctors, some functional medicine docs, some primary care docs who have a particular interest in this. And what's interesting is that a lot of docs who do a little bit of this are people who had exposure themselves, or they had family members who had exposures. So they ended up learning about it just out of their own experience. So it's crucial to find a doc who has some familiarity with stuff like that.
So you did mention CitraSafe. So that's a company that also works with the Immunolytics as part of it. Basically, when we're looking at treating the symptoms of the mold, would the CitraSafe, is that something like supplements that we take to help us, or can you give us just a little bit more of an understanding of how we would treat the symptoms?
Yeah, it is, exactly. And what you do is you clean up the environment so you don't get re-exposed all the time. And actually, CitraSafe is a company that uses citric-based products to help clean and inhibit mold growth. But as a person, for instance, you can do nasal washes that will irrigate the nasal passages. And you can actually spray medicines in there that actually knock off mold and improve the sinus situation. And then one of the things that the citrusate people came up with is if the brain's been irritated or inflamed, and of course inflammation is so many things in medicine now are all about inflammation. If you improve and give the brain the right molecules to repair itself and to operate better, then that brain can oftentimes heal up. The longer you're exposed to something like mold, like if you have a brain fog or delirium, more likely it is to go on to an actual permanent memory problems and in more severe cases. So for instance, I brought just one of the citrusate products with me. This is called Ovation, but it's a acetyl glutathione. Glutathione is one of those molecules within the brain and within other cells that help run and repair those cells. One of the keys with citrusate is that they figured out how to put acetyl glutathione into a mix that has a protective coating, a nanotechnology protective coating, so that if you take it by mouth, it goes through the stomach, as opposed to a lot of products, a lot of supplements will get broken down in the stomach, so they don't actually get absorbed. So the citrusate products get through, they get in the intestines, they get absorbed, and they circulate around to the brain. There's another product called resveratrol, and you might be familiar with that because it's got a lot of press with the French wine. That molecule in the French wine is resveratrol, but you'd have to drink, a barrel of it to get as much as you might need. Now, some of you might go along with that and say, okay, well, just a barrel a week, that's all I need to do, and get all the resveratrol I need. But citrusate makes a product that goes under the tongue. And there's also then nitric oxide is one of those neurotransmitters that gets depleted with inflammation, and you need that to help repair tissue. There are nitric oxide supplements as well. Red beet products, pine bark, French maritime pine bark works as well, and using them together. And of course, I'm one of those docs that likes to try things on myself before I give them to my patients. So I tried these supplements too as I was being introduced to them. So I added glutathione first, then I added resveratrol, and then I added nitric oxide. And sure enough, even though I don't have a big mold sensitivity compared to some, physically and mental performance-wise, it improved me. So I'm actually taking them myself because they actually work. And I've taken these products, for instance, and say, well, if this works for mold-related problems, maybe it'll work with my football players. And sure enough, you give them acetylcholine, or acetylated glutathione, you give them resveratrol and give them nitric oxide, and sure enough, their brain runs better. Now, those guys have taken a lot of impacts to the head, and so they have some permanent neural damage. And if they stop taking the supplements, then they tend to get back into the memory problems again. So they need that as a maintenance. And some people, it's not like taking some supplements and you're cured, like an antibiotic. A lot of people have to keep up with it. And the thing about supplements is that if you go into supplement stores, there's 50,000 supplements, and you don't know how many of them actually work. So part of the process for me has been sorting out, going and speaking to these national conventions and environmental groups and stuff like that, sorting out whose products actually work for my patients. So the citrusate people really, for this problem, have the best set of products. They also have the other interesting products. They have a citrus-based wash for your dogs. And they actually have, you can put different supplements that'll help inhibit mold growth within your pets. can put in the water, or even treats. So there's a way to improve that situation as well. It is tough to wash cats, as you know. I've only had two patients of mine that trained their cats, either come in the shower with them, or actually they have little special cat cleaners that they put them in, and they put the citrus safe products in with them. But cats are tough, but I'm not telling anything different to cat owners.